The two women who had been told to quarantine at Oudomphone Apartments after previous infections were reported in the apartment block. Deputy Director General of the Department of Communicable Disease Control, Dr. Phonepaseuth Xayamoungkhoun, told the Daily Press Conference on Wednesday that two women who left the red zone apartment infected area where they lived so they could self-isolate in a hotel in Vientiane have tested positive for COVID-19.
แต่ในนั้นมี2คนแม่นผู้ที่ลักลอบออกจากอพาร์ตเมนต์อุดมพรซึ่งแม่นสถานที่ที่มีผู้ติดเชื้อในการรายงานผ่านมาและไปกักตัวอยู่โรงแรม
According to Dr. Phonepaseuth, since the apartment building was classified as an infected area, residents were asked not to leave or enter. It is in order to contain the spread of the virus. However, the two women who were among the 6 new cases reported in the capital on Wednesday left the apartment building to self-isolate in a hotel without informing the authorities. It is not known if the pair went to other places while staying in the hotel, as authorities are still investigating the matter. Vientiane residents are losing hope that the lockdown will be lifted anytime soon, as new cases of the virus are reported daily. The country is currently in the throes of a 4th lockdown, with the first one starting in mid-April and the current one scheduled to end on June 19.
นอกจากจุดคงที่ข้าพเจ้าได้กล่าวไปนั้นทีมงานเฝ้าระวังยังมีการค้นหากรณีผู้ติดเชื้อใหม่แบบบุกโดยการเคลื่อนที่ไปเก็บตัวอย่างผู้สัมผัสใกล้ชิดและกลุ่มเสี่ยงในจุดที่มีรายงานกรณีติดเชื้อใหม่
Dr. Phonepaseuth said that in order to rapidly identify people carrying the virus, health officials are setting up more mobile units to collect samples for testing from people in at-risk locations. These includes government offices, markets, places of education, and factories where a vast number of people are employed. Some 500 samples have been collected at Thongkhankam Market, along with 283 samples from people in Nong Teng Nua Village and 168 samples in Khao Liao Village, but all of these have tested negative.
แต่สำหรับอยู่นครหลวงเวียงจันทน์แม้นยังมีรายงานตัวเลขการติดเชื้อในชุมชนซึ่งว่าการระบาดแม้นเกิดเป็นจุ่มในครอบครัวและคนใกล้ชิด
Dr. Phonepaseuth said the community outbreak of the virus will not end if people continue to disobey the government's prevention measures, especially social distancing, to keep the virus in check. Family members, relatives, and friends are continuing to visit one another and hold parties, causing the virus to spread.
พวกเฮาทุกคนก็ให้เป็นเจ้าการและเป็นหูเป็นตาน้ำกันเพื่อช่วยเจ้าหน้าที่ถ้าหากพบเห็นบุคคลหรือกลุ่มคนใดมีการปฏิบัติบ่ถูกต้องตามระเบียบหลักการและมาตรการที่คณะเฉพาะกิจวางออกบ่ว่าจะ
Dr. Phonepaseuth said, I urge members of the public to be ears and eyes by reporting to the police anyone who behave unlawfully, such as holding a party, entering Laos illegally, or leaving quarantine facilities. Authorities have warned that they will penalize anyone who lies or gives incorrect information to health officials, especially those who are infected with the virus. One of the main challenges facing health officials is tracing people whose COVID tests are positive and preventing them from passing on the virus to others. Without rapid tracing, community outbreaks in the capital will continue.